cotton ball, your pen light, and a paper clip will do. Straighten down on one end for sharp and the other end for dull. And your stethoscope. So, and the room's warm and ready, so you'll greet your patient. Good morning, Miss Chandler.
Good morning.
I'm Mrs. Threet, and I understand you're here for a physical exam today.
Yes.
Okay. Well, what I'll be doing is just inspecting your skin, listening to your heart and lungs, and overall check to see how you're feeling. Do you have any health problems right now?
No, ma'am.
Do you have any discomfort anywhere right now?
No, ma'am.
Okay. Do you need to empty your bladder first?
Yes, I do.
Okay. Now, what you need to do is observe her gait as she's walking away. Is it a smooth gait? Is her posture erect? Is she shuffling any? And is she alert and clear-eyed? And she is. When she smiled and talked to me, she had equal symmetry of her face. The smile was pleasant. Her structures on her facial features are symmetrical, so facial features are symmetrical. When I shook her hand, she had a good grasp, and her skin was warm and dry. And, oh, did you obtain a urine and stool specimen for the lab before you came in?
Yes, I did.
Okay.
I left it in the bathroom.
Okay, I'll inspect that later when we get finished with the exam, but no problems with that. Okay. Then I just need you to put this gown on. Okay. And then I just need you to sit right here. Oh, before you sit down, I need to check your range of motion.
Sure.
Okay. So I just need you to raise your arms up, put them back down, and then make a windmill. And then if you could put one leg out, bring it back, and the other one. Very good. So she has equal range of motion of all extremities and no stiffness or difficulty. Very good. No dizziness just then when you did that.
No, ma'am.
I said you sit up there. Going to start at the head. Always tell your client what you're going to do before you do it and make sure that if she has any discomfort that she can stop. Ms. Chandler, I'm going to start with your head. I'm going to inspect your scalp and your hair for any problems. Anytime during this assessment, at any time, I want to stress that you let me know if you have discomfort or something doesn't feel right, and I'll stop, okay?
Okay.
But right now you're comfortable, correct?
Yes, ma'am.
All right. So she has short, clean hair. Her appearance overall was well groomed. There's no odor, and your tenderness, no lesions and no lumps. Go on back here. Okay. And then you want to start at the ears. Is that tender enough? So they can see. Okay. And I'm going to go at the ears and feel the ears. And then I'm going to palpate her lymph nodes here. Any tenderness there?
No, ma'am.
Okay. And we're just going to do the mandible and the cervical chain, and I'm not going to go to the other lymph gland sites, correct? Correct. Okay. Can you smile for me and frown for me? Stick your tongue out. Close your eyes and open your eyes. Okay, so we just checked several features of the neurological nerves. And you don't have to do all those, but you ought to at least check a couple of them to make sure they're okay. Now I'm going to get the flashlight out and use it to look in your eyes, your nose, your mouth, and your ears. Okay?
Okay.
I'm going to look at your eyes first. And while the room is well lit, I'll look at your pupil size. It looks like about a 4. And then I'll dim the lights so that I can check pupil reaction. So, okay. And then brisk response. Now I'm going to check for consensual response on the other side. And there is. Oh, they're really responding well today. I'm going to check this side. Okay. Good. Now, I want you to look right at my nose. And then look at my pen. Look right at it. Good. She has good convergence. And I want you to look at the pen. And now I want you to look over there. All right. Your pupils responded appropriately. Then there's another one. You don't have to do all of these, just at least one of these eye exams. The 6 cardinal gaze of field. I want you to look at my pen and follow it with your eyes, but don't move your head.
Okay.
And I'm going to check your muscular movements of the eye. Okay?
Okay.
Oh, you're doing wonderful. That's fine. Okay, very good. So no problems with that.
No, ma'am.
Okay, I need to look in your conjunctiva. So I'm just going to pull this down gently. It's pale pink, and I don't see any veins or any drainage. The sclera is clear. You got lashes and eyebrows evenly distributed without any problems, so it looks fine. I need to, since I'm here, check your vision.
Okay.
So I want you to read the tiniest words on here.
What 2 words remember?
Okay. And I need you to look at that clock at the distance.
It's 2:11.
Very good. So your vision near and far is good. You're able to read small print close up, and you're able to read far away. I want to give you 2 words.
Okay.
Horse and trailer.
Okay.
Okay? Now I'm going to look in your ears. Someone just gently pull up to straighten the ear canal. Earlobes are intact. There is no drainage, and it's pale pink with a little bit of yellow earwax. Look over here. Pale pink. There's no drainage and a little bit of earwax. And the reason I say no drainage is because she doesn't have any active drainage. Earwax is normal. Okay, I'm going to look in your nose. And I want you to take your finger and close off one nares and breathe in and out the other. That sounds good, no obstruction. Okay, try the other side. Okay, so her nares are patent. Now I just want to look up in your nose to see if there's any problems. Okay. Her septum's intact. Her nares are a pale pink, well, almost a pale red. There's no drainage and no swelling. Very good. Now I need you to open your mouth, stick your tongue out, lift your tongue up, sideways and sideways. I'm looking for any lesions or bumps or bruises or anything at all, and I don't see anything on your tongue. Looks fine. Can you say ah? Her uvula lifts symmetrically with ah, so that's good. Now I'm going to look at your mucous membranes. Her palate's intact. She has pink, moist mucous membranes in her mouth. Her teeth are clean. She has 2 restorations on each lower in the back and 1 on the upper in the back. But those are your teeth, right?
Yes, ma'am.
Okay. Your teeth are wonderful. Her lips are pink and moist. There's no cracks or any problems with it either. You're doing very well.
Thank you.
Evidently, you take very good care of yourself.
Yes, ma'am. That's right.
Okay. So we're done with the flashlight. And now we're going to start just looking with inspection on her arms here. I don't see any, well, she does have a couple of little nevi, or freckles, if you want to call them freckles. But her skin's warm and dry to touch. Check her turgor on her forearm, and it's a brisk return. You can call it elastic. It's okay, either way. Both arms are equally warm. Check her brachial pulses at the same time, equal and strong. And her radials are equal and strong. And since you're down here, check the nails. She has short, well-trimmed nails, pale pink cuticles, no cracking, and her nail bed capillary refill is less than 3 seconds, so that's brisk. But I would say less than 3 seconds. So you're doing fine. Next, I want to listen to your lungs. So I'm going to listen to your air in and out, and I'm going to listen to your heart sounds.
Okay.
Any difficulty breathing?
No, ma'am.
Okay, you start at the apieces of the lungs by the first rib, mouth open. Listen all the way through the cycle. Up here you're going to hear the bronchial sounds or tracheal. Very good. Okay, that's the bronchovesicular sounds. This is vesicular. Okay, now listen laterally. Oh, sounds very good. Very good. Okay, now I'm going to listen to your heart. And the second intercostal right sternal border is your aortic sound of the valve opening and closing. Second intercostal left sternal border is the sound of the pulmonic valve opening and closing. Fourth intercostal space, the left sternal border is the tricuspid valve opening and closing. Then mid-clavicular line, fifth intercostal space is usually right here, is your apex, where you should listen for the heart. But I'm going to listen to all 4 areas with my diaphragm pressed firmly. And preferably listen underneath the clothes. It's easy to hear. And if the patient has a bra on, you're going to have to lift up the bra and listen underneath. And do a count for 30 seconds and multiply it by 2. Okay. We're going to pretend that we did that for 30 seconds.
Okay.
And I prefer that you do an apical radial at the same time to make sure that it perfuses to the wrist, but for the purpose of the skill test, you just have to do an apical for 30 seconds. Make sure you multiply it by 2, and your heart rate is 60 and it's regular. Heart tones are loud, S1, S2, and crisp. And that's all you have to say about that, correct? Okay, and the lungs, we only listen to anterior and lateral, but when we get around to the back, if she's clear and equal, you could say lungs, or you can say breath sounds, either one. Breath sounds are clear. I prefer you say lungs are clear, AP and laterally, and that's all you have to say, equal and clear. So, when you're on the front of the chest, I need to turn here, also look and see if she has any abnormal heaving or pulsations, any moles. You're still looking at skin again. Any scars, like if she had open heart, she'd have a scar down through here, but she doesn't. Okay, we're back here. I'm going to have her cross her arms and lean forward a little bit, and then that way I can get a good exposure of the lungs so I can listen to them well. And again, you're going to start at the top, have her breathe in and out. Make sure you don't listen over bone. Listen from side to side so you can compare. Nice and equal and clear. And you want to check chest expansion. And the way you can do that to see if it's equal is take your hands around the 10th rib. Put your hands here with your thumbs pointing inward. Would you please take a deep breath in and out? And you'll feel the hands kind of move, almost like an accordion, and it should be equal, and the thumbs start to come toward each other. They're not going to touch, but they will come towards each other. While I'm back here listening, I'm going to look and see, does she have any moles, any lesions, any skin tags, any tattoos, any bruising? And she does not. Her spinal, she has good posture. She doesn't have any kyphosis or scoliosis. I'm going to have her turn here a little bit. That way. Okay. Yeah. And we didn't percuss. Now, you don't percuss over the bone, you percuss over the lung to hear a resonant sound, which is a hollow sound. So, let's see. There we go. Okay, you're fine. And it should just be a normal hollow sound, not a booming sound, which would be hyperresonance. And if there's a question about intercostal space, all you need to do is feel in here where the depression is between the ribs, and that's an intercostal space. And that's why you go 1, 2, 3, 4, and then here's 5. So just find in yourself, in between the ribs, that's the intercostal space, just in case anybody has a question.